Hi, this is Dr. Duffy again, and this is the second in a series of videos entitled Tips for Seeing a Psychiatrist. This second video is on how to find a psychiatrist or another provider. While this second video would be helpful to anyone searching for a psychiatrist, it's specifically meant to provide my students who are on medication guidance in finding follow-up treatment. Also, it's not about finding a therapist. Starting as soon as possible to find a follow-up medical provider and get an appointment is crucial because you might not be able to get an appointment right away. Demand is high and there are not enough providers. You're competing with other college students and townspeople for a very limited number of providers in this geographical area. When you see me for our final appointment, your treatment will be incomplete and you will still likely need medication adjustment, monitoring, and clinical decisions to be made in your future treatment. It's important that you nail down an appointment with someone who will do that for you. Don't expect it to be easy to do. Here are some tips on finding a provider. On the back of your insurance card is a number for behavioral health. Call that number and get the list of preferred providers in your area. These are providers, psychiatrists, primary care physicians, physician's assistants, and advanced practice psychiatric nurses who can provide psychotropic medications and have agreed to a special financial agreement with your insurance company. The preferred provider agrees to accept as full payment your copay and what the insurance company will pay. Preferred providers can only bill you for the copay your insurance company requires you to pay, not for the balance. In return, they are listed as preferred by the insurance company and hope you'll come to them because it's cheaper. Other providers may be just as good as preferred providers, but they've not agreed to take the reduction in pay. You will also find psychiatrists who have enough demand that they don't accept insurance at all. In that case, you'll file your insurance claim yourself, and much later, the insurance company will pay you directly. If you have no insurance, the Oconee Center in Milledgeville will still see you. I've been told that they have grants that help pay them back for indigent patients. If you have insurance and go to River Edge in Milledgeville, River Edge will file your insurance and ask you for some payment on the balance. I've been told that many of their patients are not able to pay much on their balance, but I do not know that for a fact. Also, check with River's Edge to see if they currently have a psychiatrist on staff in Milledgeville as things change. If you decide to go to a primary care physician, it's very important that you inform your insurance company prior to the appointment that this physician is your designated primary physician. If you don't do this, your bill will be much higher because insurance will pay much less in that case. Insurance companies send an explanation of benefits, or EOB, form to your parents as the insurance holders. The EOB tells them the provider and dates of service. If you use insurance to pay for your medication, an EOB will identify the medications for which they paid. That makes it virtually impossible to use insurance without your parents eventually knowing. If you insist on not telling your parents, you will need to pay cash. If you're reluctant to tell your parents, perhaps your therapist could work with you on the process of telling them and discuss the pros and cons. One of the cons is that you are less likely to get adequate treatment if you don't tell your parents. You should also know that many medications require them being taken for months and often have discontinuation symptoms if you suddenly stop them. You may want to take a job to pay for your treatment if you don't want to talk to your parents. I hope you will work with your therapist to make connections with your parents. I personally believe that being alienated from your parents significantly increases your risk of suicide, and that makes it so worthy of your spending much effort to overcome. you are often surprised when you do that your parents are more flexible than you thought. There's several things you might consider in comparing one psychiatrist to another. You could check where they went to medical school, where they did their residency training, how long they've been out of school, and whether they're board certified in psychiatry as diplomates of the American Board of Psychiatry and Neurology. While you might be concerned about language barriers, in my experience as a Southerner, and you can hear me right now, there are many doctors with non-English names who speak the English language better than I do. If you Google psychiatrist near me, you need to be aware that the internet mixes up psychologists, LPCs, and psychiatrists. A psychiatrist has an MD or DO after their name, has gone to medical school and then done a multi-year residency in psychiatry. Some psychiatrists have websites that list their areas of interest. You may want to look for someone who has a demonstrated interest in your problem area. Some websites will list the psychiatrist's educational background and clinical experience. If you go to the Georgia Composite Medical Board website, you will find information about the psychiatrist's legal history, training, jobs, publications, and philosophy of practice. If you Google doctor rating websites, you'll find several. If you use these, please read all the comments on several rating sites, since one or two comments may not be representative. Beware also of biased, incorrect, or out-of-date information on these sites. The sites may give old addresses, and the doctor may have changed which insurances they accept. If you're planning on seeing a provider near your home, you might want to ask your family doctor or your family doctor's office manager, to whom do they commonly refer their patients. Whether it makes the most sense to see a psychiatrist, primary care physician, APRN, or PA depends on your particular clinical situation. If I did not get to it in the first session, bring it up in the second session and we'll discuss it. Our center has put together some lists of providers who practice in different areas that might be near you. By making these lists available to you, we are not endorsing these providers. Also, some providers will not provide psychostimulants without documentation from the referring provider. You will need to ask about that if you're taking Adderall, Ritalin, or Vyvanse, for example. You'll find these lists on GCSU in the section of the website Resources and Required Assignments for Dr. Duffy. Thank you.